How to balance your blood thinners and bleeding risks. Here's what you need to know about anticoagulants, and what to do if you have dangerous bleeding as a side effect. Anticoagulants, aka blood thinners, are drugs that prevent the formation of blood clots. They can also stop the growth of blood clots that could be fatal. Although these drugs reduce your risk of life-threatening blood clots, they have the potential side effect of excessive bleeding. Each year, about 2 to 3 million people in the United States will need to take a blood-thinning medication, according to the National Blood Clot Alliance. These drugs help prevent blood clot complications if you have a health condition that puts you at risk for clots. They're an important part of treating atrial fibrillation, deep vein thrombosis, and pulmonary embolism. Commonly used blood thinners include comednorjantov, warfarin, Pradoxa, dabigatran, Xarelto, rivaroxaban, Ilokaz, apixaban, and Savsa, edoxaban, among others. For most people, the benefits of blood thinners outweigh the risk of a dangerous bleed, says Andrew Freeman, MD, a cardiologist at National Jewish Health in Denver and a member of the American College of Cardiology's Patient-Centered Care Committee. Bleeding risk occurs on an individual level, adds Dr. Freeman. So doctors must have a conversation with patients about their risk of falling or injuring themselves. Bleeding risks associated with warfarin. For decades, warfarin was the mainstay of anticoagulant treatment. The drug works by targeting vitamin K-dependent factors involved in blood clotting. Warfarin takes time to work in the body and requires constant surveillance by your doctor, including frequent blood tests, to make sure the drug level stays in the right range to work effectively. A number of other commonly used medications, including laxatives, aspirin, and cold or allergy medicines, can interact dangerously with warfarin. Even foods and drinks such as cranberries, alcohol, and green leafy vegetables, because they contain vitamin K, can interact with warfarin and may put you at risk for excessive bleeding. According to the Mayo Clinic, if you're taking warfarin, you're more likely to have bleeding problems if you're older than 75 or take other types of medications that can increase your bleeding risk. The risk of a dangerous bleed with warfarin also increases if you have any of the following: high blood pressure, hypertension, kidney problems, cancer, alcoholism, liver disease. Newer anticoagulants and bleeding risks. Anticoagulant pills that inhibit blood clots include Xarelto, Ilokaz, Pradoxa, and Savsa. Each of these slows down blood clotting in a more targeted way. According to a study published in December 2015 in the American Journal of Medicine, more patients who have an irregular heartbeat known as atrial fibrillation are now using the newer drug thinners. The newer drugs all seem to be as effective as warfarin, or a little better at preventing strokes, says Mark Kozak, MD, a cardiologist at the Penn State Hershey Medical Center in Hershey, Pennsylvania. But it's not yet known whether the newer drugs come with a decreased incidence of bleeding. Research is ongoing. A study published in April 2015 in the Journal of the American Heart Association found that Pradoxa could be more effective than warfarin in preventing stroke in patients with atrial fibrillation. But it also found Pradoxa was associated with a higher risk of gastrointestinal bleeding. And a study published in April 2015 in the BMJ compared Pradoxa, Xarelto, and warfarin, and found that rates of gastrointestinal bleeding varied among the three drugs, but not enough to be statistically significant. Benefits of the newer anticoagulants include that they start working within hours of the first dose, wear off within 24 to 48 hours, have far fewer interactions with medications and foods, require little or no patient monitoring, drugs that stop excessive bleeding. If you're taking warfarin and have a bleed, Vitamin K is an antidote that blocks the drug from acting. But if a patient's blood is thinned from warfarin, it will take 12 to 24 hours for vitamin K to reverse the effect, and the effect requires a healthy liver, Dr. Kozik says. There are no known direct, immediate reversal drugs for the newer blood thinners Eliquis, Xarelto and Savsa, though a lot of research has gone into designing drugs to help with the reversal of newer anticoagulants. In October 2015, the Food and Drug Administration granted accelerated approval to Praxbind, a drug that will reduce the blood-thinning effects of pradoxa in the event of a serious bleed. Researchers are currently working on antidotes for Eliquis and Xarelto. But in the event that you have a dangerous bleed when using these drugs, doctors work to control the bleeding source and replace the elements of blood that are lost, such as platelets or plasma, says Matthew Levy, DO, Associate Professor of Emergency Medicine at Johns Hopkins University in Baltimore and Chair of the Stop the Bleeding Coalition. Related, how to steer clear of side effects from blood thinners, signs that you may be bleeding internally. If you take anticoagulants and fall or are in an accident, you should get checked out right away regardless of whether you have any external bleeding. People taking anticoagulants should have a lower threshold to call the doctor or go to the emergency room, Dr. Levy says. Adds Dr. Freeman, it's better to be safe than sorry, because bleeding can be catastrophic if not dealt with immediately. A dangerous bleed is often internal, so it's important to be aware of any signs or symptoms. Things to look out for include blurred vision, lightheadedness, abnormal bruising that starts to get bigger, dark, tarry stools, shortness of breath, headaches, profound weakness. If you experience any of these symptoms while taking a blood thinning medication, see your doctor.